Welcome to Sparks of History, where Jewish history and world history meet. We are very honored and pleased to have with us today Dr. Jeremy Brown. Dr. Brown is an emergency physician and currently director of the Office of Emergency Care Research at the NIH, the National Institute of Health. Dr. Brown studied medicine at University College, London, and trained as an emergency physician at Boston Medical Center. Previously, Dr. Brown was the research director in the Department of Emergency Medicine at the George Washington University in Washington, D.C. Dr. Brown is the author of over 40 peer-reviewed papers, as well as 4 books, including 2 textbooks on emergency medicine published by Oxford University Press. And today, we will be discussing Dr. Brown's more recent work, which we have right here, The 11th Plague, Jews and Pandemics, From the Bible to COVID-19. And as you can see, it is a thick book full of a tremendous amount of insights and information, which hopefully we'll cover at least part of it today. Dr. Brown, thank you for joining us. We appreciate it very much.
My pleasure. Thank you for inviting me.
Just to get started, what inspired you to write The 11th Plague, and how did your background influence this project?
As you mentioned in the beginning, I trained as an emergency physician, and a few years ago, I actually wrote a book on the history of the Great Flu pandemic of 1918, which was commemorated in its 100th anniversary just a few years ago in 2018. And that book really introduced me to the whole project of writing and researching about, specifically about disease, and writing about it in a way that is open and available for non-experts to read and enjoy. So that was sort of my writing background. And in parallel to all that, I had for many years been studying Daf Yomi, the 1-page-a-day Talmud cycle, and I had been collecting a lot of references to diseases, many of which I had published on my website called Talmudology. But I decided really during COVID that it was a good time to perhaps join these two worlds, one of writing for a general population, and a second of really taking a deep dive into illness and disease. It was a good time for me to put much of what I'd amassed together and do some more research. And so in many ways, COVID, which came along at the beginning of this project, really acted as an inspiration, not as an inspiration, but really as a catalyst. And so I began this work early in those COVID years. And I didn't really have a hypothesis to test. I just wanted to look at the sources and let them speak for themselves and reach any conclusions much later.
Okay. Before getting into specifics, can you perhaps give us just an overview of how Jewish communities historically have responded to pandemics?
One of the things that I learned in doing my research is that when COVID hit us, our reaction was very, very unusual in terms of the historic reactions that humanity has had to diseases. Because for nearly all of our history, indeed only really in the last couple of 100 years, have we had anything like a vaccine or more recently antibiotics. But for the vast majority of human history, there were always pandemics and plagues, and I liken them to the weather. You sometimes take note of it, you sometimes don't, but it's always there. And when you think about how the Jewish community responded to pandemics, the first thing I think we should realize is that the Jewish community, like all communities, saw pandemics as part of its, and plagues and disease, as just part of the weather, part of the natural background of life going on. For us, of course, it was quite different during COVID because we're not used to having illness as a background disease. We used to not thinking about it at all, especially infectious diseases. We used to not thinking about these things at all. And so I think the first thing to think about is that the Jewish communities, in many ways, didn't react specifically to pandemics, because it's like asking, how did the Jewish community respond to the weather? It was always there, but it was something that sometimes got worse and sometimes got better. So having set that as a sort of a general framework in which to think about this, there are, of course, lots of examples specifically on how the Jewish communities across the world have responded specifically differently, if you like, to the challenge of having infectious disease in their midst. One example that I give in the book, and this is really one of my favorite examples, is how infectious diseases and pandemics actually changed the rhythm of Jewish life. So we have a sefer called China V'Chista that was published in 1884 by Rabbi Yehoshua Shlomo Ardit. And he noticed that in the towns and villages in Western Turkey around Izmir, he wrote that life was very predictable and controlled by the cycles of plagues and pandemics. And he writes in his book that many marriages in his community in Turkey were conducted during the winter months, but after Pesach, after Passover, you couldn't really arrange a marriage, because then, he writes, the overwhelming majority of people became ill with the plague. Sometimes the epidemic would last until the end of the spring, and that is why many of the inhabitants would have left for other villages and hamlets. Now, it's very easy to overlook this comment, which is really in his parish, in his commentary on a Talmudic tractate, Suvot, that really addresses the laws of marriage contracts. But in these just few lines, here, you see how Jewish communal life was so ruled, as it were, was so affected by plagues, that the daily rhythms would change, and weddings, in this example, came to an end because of the typical outbreaks year by year in the summer of, in this case, bubonic plague. There's another example, of course, of the specifically Jewish way that we've responded to plagues and pandemics. And that's the examples of scholarship and printing. And again, I give several examples of this in the book, but one of the earliest, and certainly one of the most striking, is a sefer published by Reb Moshe Isserles, the Ramah, the great Polish rabbi who's famous for his commentary on Shulchan Aruch, on the Code of Jewish Law. And what is less well known about him is that he, as a young man, Reb Moshe Isserles had fled, Reb Moshe Isserles had fled from one of the plagues in Krakow. And he writes that in the year 5316, which is equivalent to 1556, he had fled the town of Krakow, and he was unable to celebrate Purim in Krakow because of the plague. And so he decided, while in this self-imposed exile, to write a sefer, to write an explanation of the Megillat Esther, of the Book of Esther that we read on Purim. And so here you have an example that the very first book written by the great Rav Moshe Isserles, which was called Mechir Yayin and was published in 1559, this book's genesis really was as a result of the Ramah having been forced into exile, and he wanted to have some kind of intellectual Jewish project that would keep him perhaps focused. And this was a result. So we have examples in Jewish life of where the daily rhythm has been affected by plagues and pandemics, and also where the rabbis and scholars were often encouraged by their very troubling and difficult circumstances to reach new heights by publishing in response to pandemics. So those are just two examples of how Jewish communities have historically responded to pandemics.
If we go all the way back to the Bible, to the Torah, to Tanakh, the prophets, how are plagues and pandemics portrayed in those holy writings? And what lessons can we learn from these narratives? I assume plagues, obviously, since it's in the Bible, there's a spiritual connection or explanation for all the plagues. So how do you view it? How did you present it in the book? And what lessons can we learn from those?
Well, there is most certainly a spiritual dimension to the plagues as they're recorded in the Torah and in the Tanakh. I mean, we all think obviously of the 10 plagues in Egypt, which were recorded to have been a direct result of Pharaoh not letting the Jewish people go. They were a divinely inspired, directed series of plagues and pandemics against the Egyptians, and that certainly had a spiritual message behind it. Incidentally, I called my book The 11th Plague because the 11th Plague is a sort of a stand-in for all the diseases that came after those 10 plagues. But the 10 plagues are, of course, the most famous pandemics or outbreaks that are recorded in the Bible, in the Torah. But we have many other examples of plagues and pandemics in the Tanakh. So for another example of pandemics that are found in the Torah is actually found in Bamidbar, in the book of Numbers, when the spies return with a very pessimistic report of the promised land, and they die, but Mageifa, they die in a plague. There's another example when the followers of a revolt led by Korach were killed in a plague that took, the Torah tells us, 14,700 lives. And another example of a plague or pandemic in the Torah was one brought by God to punish the men or the Israelites after they had profaned themselves with the Moabite women, and that story is told in Bamidbar chapter 25. And in the outbreak that followed that immoral behavior in the Mageifa that came afterwards, we are told that 24,000 people died. And in at least some of these instances, the outbreak was brought to an end by the Kohanim, by the priests. For example, in the plague of Korach, Aaron, we read that Aaron waved the incense that were brought in the Mishkan. He waved them around. These are the Ketoret as he ran through the camp, and this is how he ended the disease outbreak. So here's at least 3 examples: the 10 plagues, the revolt of Korach, and the punishment brought against the people who had been immoral with Moabite women. So that's 3 examples right off the bat of plagues, and that's just in the Torah. Another well-known example that we find actually in Sefer Shmuel is, of course, the famous plague that struck the Philistines after they had captured the ark. If you remember the story, the Philistines captured the Aron, the ark, and it was taken to Ashdod. And then there's a plague in the temple in Ashdod, and the Tanakh tells us that God smote Ashdod and its territory with swellings, and it's a long and complicated story, but at the end of it, the Philistines decide that holding on to the holy ark is too risky, and they send it back to the Israelites, but they also send it back with an indemnity, and we read that they sent it back with some very odd gifts. There were 5 golden swellings, Chamisha Aflei Zahav, and then V'chamisha Achbei Zahav, and 5 golden mice. And this was sent back to the Jewish people with the ark. So here you have an example of a plague that is mentioned in the Tanakh, not in the Torah, but in the Tanakh. And this plague was so famous that the artist Nicolas Poisson, who died in the mid-17th century, painted the plague of Ashdod, perhaps one of the most celebrated plague paintings of the 17th century. And you can really see there many of the details that are mentioned in Sefer Shmuel. You can see those painted in this really masterpiece that Poisson produced. And finally, we also find plagues in other parts of Tanakh. For example, in the book of Habakkuk, in the 3rd chapter, we're warned that pestilence marches before him, V'yetze reshef l'raglov, and something called reshef strikes or comes to the heels. Nobody really understands what reshef means. Many of the biblical Mufarshim describe it as a kind of an arrow or a glowing coal. But Reshef was actually a Phoenician and Egyptian god, often associated with war and illness. And so what you have here perhaps is an example of a god that was elsewhere identified by other peoples as associated with war and illness. And here it becomes a sort of a shorthand for a plague that can attack us. So there are many examples of plagues and pandemics throughout the Tanakh. In terms of the lessons that we can learn from them, I think for many of these things they come as a result of inappropriate behavior, whether that was rebellion with Korach, whether that was not listening to God's word, whether that was inappropriately taking the Holy Ark from the Jewish people. They all come as a consequence of inappropriate or sinful behavior. And over the many centuries that have intervened between the time of those writings and today, we have a quite different attitude towards plagues and pandemics as to their origin. And you can also find that, and I hope we'll talk about it later, you can also find that in the Talmud itself, where plagues are not necessarily seen as a result of some spiritual failing. They're just seen as a random act of nature.
And as a physician and as a scientist, when you look at the plagues that are biblical, is there any other way do we have enough information to interpret their causes and what it's all about, or we're just left in the dark because we don't have the documentation to really analyze those plagues?
I think in some instances it's very clear what the plague was, and that the best example of that is the plague of Ashdod, which almost certainly was bubonic plague because of the descriptions that we have. There are mice involved, and we know bubonic plague is spread by rats and mice. There are swellings that are involved, which is a hallmark of bubonic plague. So at least in that instance, we know not exactly, but we have a very, very good sense of what that was. Other plagues and pandemics, I think, are much, much harder. Certainly, we don't know what the outbreak that occurred after the revolt of Korach was. But when it comes to the original 10 plagues themselves, there is no end to scientific attempts or explanations of the 10 plagues. And I spent some time in the book talking about these. Sometimes the plagues were thought to be occurred from volcanic eruptions. Sometimes they were contamination of water. I mean, people have many, many hypotheses as to what the 10 plagues were caused by in terms of a scientific approach and how one led to the other. Ultimately, I think all of these particular explanations are really quite. They don't meet the mark, I think, and they're really quite lacking in many ways.
And a few of the key historical pandemics that significantly affected Jewish communities. What are those? What are prime examples of those? And is there any truth when we talk about plagues? There's this notion that because of Jewish ritual practice of keeping clean and washing the hands and et cetera, that Jews were in many cases not affected as much as the general population.
All right, so let's leave that last question. Let me come back to that. That's a very important question that I address in a whole chapter in the book. But you started by asking about the key historical pandemics that have affected Jewish communities. Look, all of us listening to this have lived through a historic pandemic that significantly affected the Jewish communities of Israel and the diaspora, and that is, of course, COVID. But if we're looking sort of at a longer time, more historically, if you like. At the beginning of the book, I list close to 140 examples of pandemics that affected the Jewish people, most of which we are completely unaware of. I certainly was unaware of nearly all of them before I started my research. An example of something that significantly affected the Jewish community was the death of Isaac Luria, the great founder of Lurianic Kabbalah, the Arizal, who himself died at the age of 38. Many of us know this, but he died. What did we die of? He died from plague in 1572. In 1715, there were a third of all the Jews in a town in north central Bohemia were killed from a plague. In 1747, the Kabbalist, the great poet, the Ramchal, Moshe Chaim Luzzatto, died of a plague in Akko, Akkar in Israel at the age of 39. This is just a few examples of the many important historic figures who've given us such a rich and complex. Now, let me rephrase that. These are just some examples of some of the key figures in Jewish history whose deaths were brought about by as a result of plagues. Particularly, though, in the book, I do focus on a few specific plagues. There's a chapter on bubonic plague, which really was around the Black Death that began at the end of the 14th century, although bubonic plague did continue in spasms through Europe for many, many centuries afterwards. So I have a long chapter on bubonic plague. I have a chapter on smallpox, a disease that none of your listeners have seen because it was eradicated from the world as a result of vaccination, but it was a terrible disease and probably killed 1/3 of all children under the age of 14 or 16. 1/3 of children died from smallpox. And there's another chapter on cholera, which is swept through Europe and, of course, parts of America in the 20th century. And that resulted in many different reactions to disease, one of which was something called the Black Wedding, or the Plague Wedding, or the Schwarze Chasna, or the Magefa wedding, in which Jews who were in a shtetl, usually it's restricted mostly to Eastern Europe and Israel, although some of these weddings actually took place in the United States, and one is recorded in Canada, where when faced with a pandemic, the community would find two people who were down on their luck, orphans or people with physical disabilities or mental disabilities, a man and a woman, and they would marry them off in a cemetery, often under a black canopy, and then they would make a big celebration and would give them gifts to get their marriage off to a good start. And this plague wedding was really thought to have been a way to show God, if you like, that we, your people, are being kind to those who are unfortunates in our community, and maybe you too could be kind to us. So those are some of the historic pandemics that affected the Jewish community. Of course, they affected the community in many, many different ways. I want to very briefly come back to your question of, is there any truth to the contention that because of Jewish law, because of halakha, that Jews died in fewer number than the surrounding communities of non-Jews, and often this is cited as a reason that the Jews were blamed for the Black Death. You know, there was this rumor that became more than a rumor. There was an accusation that the Jews were poisoning the wells and causing the Black Death. And the reason that they could do that was because they were dying in fewer number. This is something that I think many of us might not know the source for, but certainly it rings a bell for many of us. I certainly grew up with knowing that or hearing about that. I can't tell you where I learned it from or who first told it to me, but I grew up with that notion, and I spend actually an entire chapter looking at whether that myth is true. I call it the myth of Jewish pandemic exceptionalism, that the Jews were somehow exceptional and less likely to have become ill from many, many pandemics, from bubonic plague all the way through to cholera and COVID. Unfortunately, there is not a shred of evidence to this, or in fact, all the evidence from eyewitnesses about the real Jewish death rate during the Black Death show that the Jews died in equal or greater numbers than did the surrounding Gentiles. This is also true in outbreaks of the Black Death that occurred in Padua and Rome later. There is also unfortunately, no biological plausibility to the claim that Jews were less likely to die in the Black Death because of halakha. If you think about it, just take one quick example. COVID is spread through coughing and sneezing. It is not spread through hands. It's not, you don't generally get it from touching somebody. So however much you wash your hands, if you cough or breathe over somebody, that's what it's going to spread the illness. Interestingly, some of us may not be aware, but in Eastern Russia, in the 1900s, there was actually a fear of too much bathing. This has nothing to do with halakha and mikveh, but this is just sort of what happened in European society. And some people were thought to have been washing too much. We also know that Jewish burial customs are also thought to have played a part in the myth of fewer Jews dying than Gentiles. Unfortunately, again, there is no evidence to this. And in fact, the historic evidence that we have show that the bodies that were left as a result of pandemics often lay unburied for many, many, many days. We have a Yiddish account of this in a work from Moshe Ben Chaim Eisenstadt of what happened during bubonic plague in Prague, where he wrote that the dead were unburied, left unburied for an unacceptably long time. We have also accounts of, I guess they would be members of the Chevra Kadisha demanding extra pay for the removal of the Jewish dead during a pandemic. So all of this is to say, and as I say, I have an entire chapter on this, all of this is to say that there are no eyewitness accounts of Jews dying in fewer number. In fact, the story that Jews died in fewer numbers only begins 100 or so years ago, after the end of the first wave of the Black Death. All the eyewitness accounts tell us that the Jews died in equal or greater numbers. There's no biological plausibility to the claim that somehow halakha, if you keep it properly, would prevent disease from spreading. And unfortunately, as I say, this claim of Jewish pandemic exceptionalism is a myth. I mean, I wish it were true, but it's not. Famously, Rabbi Lionel Blue in London noted that he said the Jews are like everyone else, only more so. And so far, I know of no known exceptions to his observation. And I think the myth of Jewish pandemic exceptionalism, the claim that Jews died in lower numbers because they kept halakha, tells us more about people who are making those claims now and what their attitude is towards the things they believe in, rather than it being reflected in any kind of historic reality.
You had mentioned, Dr. Brown, this custom of Black weddings, cemetery weddings, which I'm assuming, not knowing, that there really is no source in Jewish law that normally would permit a wedding in a cemetery. Sounds like it would be contrary to Jewish law to perform a wedding in a cemetery. What are other examples of customs, rituals, practices, religious practices that came about as a result and in response to pandemics?
Yes, I think you're quite right. In the book, I know, just as you said, that we're actually forbidden to have to hold rituals in cemeteries, and we're forbidden to actually perform certain religious signs in cemeteries. Famously, there's a prohibition for those people who wear their tzitzit outside. Is a prohibition about showing those in a cemetery. It's thought to be insulting to the memory of the dead who are no longer able to perform mitzvot. Not unfortunately, but somehow this evolved, and it was overwhelmingly accepted. There were notable rabbis who spoke out against the custom. There were many maskilim spoke out against the custom, but yes, somehow the way that Jewish law was practiced, the way that Jewish life was practiced wasn't always in keeping with Jewish law. Now, you asked about religious practices that were adapted in response to the pandemic. I have a chapter on fasting, prayer, and pandemic theology, and I'll just give an example from that. We have Tehillim, Tzadi Aleph, Psalm 91, which I think most of your listeners will recognize as from the opening words, Yoshev B'Seser. In that psalm, the psalmist lists a whole load of dangers and tragedies, snares and terrors, and almost certainly these are referring to to pandemic. And what happened was that this amulet psalm, as it's sometimes referred to, or Shir Shel Pagaim, a song to ward away evil spirits, or Shir Shel Negaim, a plague song, actually became part of a ceremony that none of us keep anymore, and it's called Havdalah de Rabbi Akiva, the Havdalah of Rabbi Akiva. We all recognize Havdalah that we say at the end of Shabbat or at the end of Chagim, of holidays. But the Havdalah of Rabbi Akiva was a much, much longer ceremony, which incorporated Yoshev B'Seser into it. Now, we do say this psalm, Yoshev B'Seser, on a Saturday night, on a Motzei Shabbat. Perhaps that's how it found its way into that particular spot. But this ceremony of Havdalah de Rabbi Akiva was part to ward off witchcraft, part to ward off evil spirits, and was actually said quite widely from the Jewish communities of Bavel and Italy and Spain, and also the Jewish communities who were living in Ashkenaz. So we don't say this anymore, but this is an example of a religious practice that was widely used by Jews in many, many different communities that arose really as a result of trying to pray for a week that is free of plagues and pandemics.
Is there any connection to the fact that this is called the Havdalah, the ceremony of Rabbi Akiva, and the fact that the plague of Rabbi Akiva's students, is there a connection there?
I'm not aware of one, but I think it's a fascinating observation that you make. It's a fascinating observation. Yeah, it could be.
What was the plague of Rabbi Akiva, if we're just talking about it?
So I don't think there is enough evidence to know what from what they died. The Gemara talks that they spoke Lashon Hara about one another, so therefore they were punished in the throat, which is the where we produce sound, and some have speculated that this therefore was a disease known in the Talmud as askara, but known to us as diphtheria, which causes basically a closing of the airways, terrible disease before vaccines came along. And that is, if you're going to make a claim about that, then that is a likely contender. Of course, it was a very common disease back then. You have to be careful, though, how you use these things, because the great founder of the Daf Yomi cycle, whose name I'm completely blanking on now. Help me out, Ari.
Rameir Shapiro.
Rameir Shapiro, thank you. So the founder of the Daf Yomi cycle, Rameir Shapiro, died from an infectious disease that is described as diphtheria, as askara. And if you say, well, the Talmidim of Rabbi Akiva died as a result of their Lashon Hara, they were smitten with askara. Unfortunately, so was this great and saintly rabbi. So you have to be very careful when one starts assuming or equating diseases with moral failings and punishment. So that's just an aside onto the plague of Rabbi Akiva, as you asked. Let me just give a couple more examples about
Please.
how Jewish rituals and religious practices changed. Of course, we say Pitam HaKatoret, that evolved into a protection against pandemics. It was widely found in different orders and services that was said during COVID. And I have a part of the chapter in the book is explaining how this list of ingredients that is mentioned, because on the Ketoret is a list of ingredients that is mentioned in order to produce the incense in the temple, how it evolved into a protection against pandemics. Some communities wrote special prayers. An example is a prayer that was composed probably in Italy in the late 18th century. I have a photograph of the original in the book, which was a prayer to end an outbreak of disease amongst cattle. Very unusual prayer. I found it in the Library of Congress here in Washington. That was a special prayer that was composed. Of course, we have a line in Avinu Malkeinu that is said on fast days in the Ashkenazi minhag. Avinu Malkeinu Mena Magefo Min Nachal Asecha. Our Father, our King, prevent plagues from us, from your inheritance. So there are different versions of this. Some versions say Atzor Magefa, but in any event, you can see that this is the way that plagues crept into our tefillah. Perhaps one more example is a series of tefillot that we add on a Monday and a Thursday, right after we read from the Torah at Shacharit. Yehi Ratzon Milifnei Avinu Shebashamayim, and then L'Rachem Aleinu Ve'al Pleitasenu, and then these words V'lim Noah Mashchisu Magefa Mi'aleinu Mi'al Kol Beis Yisrael. May it be the will of our Father in heaven to have compassion on us and to keep plagues and destructions away from us. So every Monday and Thursday we actually pray out loud, because these tefillot are said out loud by the shliach tzibur, by the person leading prayer. We actually say out loud, may God have compassion on us to prevent magefa, to prevent plagues from us. It always struck me as kind of ironic during COVID when, unfortunately, I would often see the shliach tzibur just sort of mumble these words during COVID as the service progressed towards the end of Shacharit. And I thought, if you're not going to stop and actually say these words with particular kavanah, with particular meaning, it's a real wasted opportunity. So we have several examples then of ways in which prayer evolved and changed to include many references to ending plagues and a tefillah to keep us safe from pandemics.
And what are some of the rabbinic approaches in discussions that one finds historically during pandemics in regards to public health and safety and responsibilities, obligations, rabbinic opinions?
Well, I think we should sort of break that down into two very large general categories. We have the rabbis of the Talmud who do discuss plagues and pandemics and the right behavior there, but it's only a couple of lines. Then, of course, there's the entire corpus of Jewish law that followed, as well as local rulings made by particular rabbis or leaders of congregations. So, for example, the Gemara, the Talmud in Bava Kama talks about what should happen if you encounter a pandemic, a mageifa, and the Gemara tells us that you should gather your feet, which is widely assumed to be instructing us to limit the time you spend outside and to sort of self isolate, which is exactly what we do during COVID. So that's a sort of a rabbinic approach to plagues and outbreaks that we find during the times of the Talmud. the later poskim really really adapted their particular rulings to the kind of diseases that were prevalent. I mean, the famous example that many of your listeners might have heard of, and I certainly include it in length in the book, is Rabbi Akiva Eger, the great leading rabbi and posek in Poland at the end of the 18th century, who wrote a series of edicts as to how the Jewish community where he lived, and eventually these were actually spread far and wide across Europe, and how the Jewish community should act in terms of not fasting on fast days. This was during the outbreak of cholera, incidentally, including staying isolated from each other. He had a special ruling about how to accommodate people during Rosh Hashanah and Yom Kippur, when typically the shuls, the synagogues, would be flooded with people. Rabbi Akiva Eger writes that you basically had to have a ticket, and you would either get a ticket for Friday for first day Yom Tov in case of Rosh Hashanah, or second day Yom Tov, or in case of Yom Kippur, you would get one for Kol Nidre in the evening or sometime during the day. The only people who were exempt from being able to only attend one of the services were the rabbis and leaders of community and their wives, who's got some kind of a pass and were able to attend all of them. But Rabbi Akiva Eger writes that he would post a police officer outside to make sure that everybody kept the peace and nobody tried to sneak into shul when they shouldn't do. So this is an example of really a rabbinic edict, a religious edict that was produced as a result of a terrible outbreak of cholera in Europe. There are many other examples, but I can give you perhaps one more that really goes to sort of rabbinic innovation during plagues and pandemics. So Rabbi Yechiel Michal Halevi Epstein, who wrote the Torah Tamima. I'm sorry, no, he didn't write Tamima. That was his son.
Aruch HaShulchan.
Yes. Let me start again. Rabbi Yechiel Michal Halevi Epstein, who died in 1908, wrote a famous halachic work, the Aruch HaShulchan. His son wrote the famous work, the
Torah Tamima.
The Torah Tamima, thank you. And he writes in the Aruch HaShulchan that if there is an outbreak of smallpox, the general ruling was that there would be a fast day and that people would stay away from it. And in other words, they would self-isolate. But he writes there that that nowadays, because of the vaccine against smallpox, the rulings have changed as a result of the disease not being either around or not being anywhere nearly as dangerous. And so here you have an example of a ruling that for many generations, since the time of the early poskim in the 15th century, was in place regarding smallpox, but it changed once a vaccine was produced. According to the Aruch HaShulchan, we could behave differently. So another example of how the rabbis changed their rulings and the way they would think about things as a result of some of these outbreaks.
COVID-19. How did Jewish communities across the globe respond to COVID-19 in comparison to the reactions to past pandemics? And why was there so much controversy? And the controversy remains today. Underreacted, overreacted, exaggerated, right. All the tumult that went on and that's still going on in terms of what was COVID-19 and what should the response have been, and etc.
Yeah, you're perfectly right. And of course, that tumult, as you describe it, that controversy is largely around the secular authorities, the governments of many countries who initiated certain laws during COVID that at the time, and certainly now in retrospect, there's some controversy around them. But in terms of the Jewish community, look, we can't really say how did the Jewish community react, because the question is, are you talking about Jewish communities in Israel? Are you talking about Jewish communities outside of Israel? If you're talking about outside of Israel, which particular country are you talking about? Which kinds of Jews are you talking about? Reform Jews, conservative Jews, modern Orthodox Jews, Hasidic Jews? And if they're Hasidic Jews, which sect? Are you talking about Haredi Jews? So I think, to talk about a Jewish response is impossible. You cannot. You can only talk about the particular local responses that were made, and then sort of try and understand where they are. The Reform and Conservative movement quickly pivoted to virtual services. The modern Orthodox community was, of course, unable to do that, and they responded in other ways. My shul here was closed for several weeks, and when it was allowed, there was davening outside. There are many examples, unfortunately, of communities that flouted regulations. It's not limited to the more Haredi or Hasidic communities. There were members of modern Orthodox community who were famously flouting rules in Australia, and it came to the attention of the press and the government. But generally, I think the tumult and the controversy here is the amount of attention that was paid to some Jews who were not following government regulations. And this actually, I address this in the book when I have a chapter on anti-vaxxers. This is not, I want to make very clear, this is nothing to do with their Jewishness. Their objection to vaccines was not at its fundamental level about being Jewish and looking at Jewish sources. The objection was the objection of an anti-vaxxer. These were people who were, at first, their core identity was anti-vaxxers, and their second identity were as Jews, often Haredi, sometimes Hasidic. And it's no surprise that they reacted in that way, because we find lots of examples in society where the more extreme members of any religion, whether it be Islam, Christianity, Judaism, the more extreme members, what we would call the more fundamentalist members of a community, are generally far more skeptical of government control. They get their news in very different ways from other people. And so when I think about Jews behaving badly, or Jews who didn't get the vaccine, you have to really separate and understand what you're talking about, which parts of the community you're talking about. And you have to understand their behavior, not in terms of their Jewishness, but in terms of their activity as anti-vaxxers who happen to be Jewish. So I think that at least in my mind, goes some way to thinking intelligently about what was happening at those, at the far fringes of society. In both general society.
So for them, it wasn't even about government regulation, but to them it was almost a medical issue. This is wrong. Yes. This is harmful medically.
To some degree. Again, the anti-vaxxers, and I bring examples in the book, including interviews with Haredi anti-vaxxers in the north of, I think it's in Manchester. One woman wrote in response to an interview, if the rabbis told us to vaccinate, we wouldn't. And this was a Haredi woman. Now, the hallmark of being a member of the Haredi community is obedience to halacha and rulings that are made by a local rabbi. Here was a card-carrying member of the Haredi community saying, yes, but if the rabbi tells us to vaccinate, we're not going to. So you can clearly see in this, it is only one example, but it's so emblematic of this kind of thinking that at its core, it's not Jewish thinking. At its core, it's anti-vax thinking that happens to be expressed in this example through someone who's Jewish. There are anti-vaxxers who are Christians. There are many anti-vaxxers who are atheists and claim to have no religion. So the anti-vaxxers as a group have more in common with each other than we think. And I think we should not lose sight of the fact that overwhelming majority of the Jewish communities in Israel, where the Jewish community is the vast majority of the population in Israel and outside Israel, followed government regulations as best they could and were delighted when they could get the vaccine.
Dr. Brown, what do you think are some of the enduring Jewish-related consequences of COVID-19 that we see today and that we might continue to see in the future?
So in terms of the enduring lessons and our responses, I think optimism is a very, very important lesson in how we move forward. COVID itself was terrible. Of course it was, and it did not affect us all equally. It was a disease that affected different socioeconomic groups, different populations in very, very different ways. But as I mentioned earlier, the Jews, and indeed I think all of humanity up until the modern medical era, had always viewed pandemics as a fact of life that one shrugged about and got on with it. And I think thinking about the pandemics as thinking about the weather, at least that's what it was before the modern, that's how it was thought about before the modern era. I think optimism and the reaction, I think, of Jews who were spurred to great religious heights by outbreaks of plague, by writing books and so forth. I think that's a really important lesson that we could learn. And of course, it's only the tiny minority of Jews who will write a sefer and publish it. But on an individual level, there are so many important ways to react to pandemics that the history of our people's reaction to pandemics teaches us.
In conclusion, Dr. Brown, what would you say was the most surprising discovery that you made while doing the research and writing the 11th Plague?
It's like asking me to choose my favorite kid or grandkid.
Well, we're not supposed to do it, but I think we do it all the time. Sometimes, I don't know.
I found surprising or enlightening the true story, as we mentioned earlier, about Jewish pandemic exceptionalism, this idea that halacha somehow protected the Jewish people from pandemic outbreaks, which unfortunately, as we mentioned, there is no truth to that. That was a discovery that was both, in a way, disappointing. It would be nice if it were true. But I feel that it also led to a greater realization, of course, that the Jewish communities never responded by themselves. In fact, they often reflected the reactions and the responses of the wider community. And to see Jewish reactions and then to compare them with specifically Christian or Muslim reactions, which I do several times in the book, you really see that different communities are really addressing the same problem. It's just in slightly different dialects. And I speak Jewish dialect, so for me that's the most important and the most interesting. But there are other dialects out there that show us how people react to pandemics. As I mentioned earlier, there's only one ironclad law of pandemics, and that is that they all come to an end. The question is only how much damage each one does until it's finally extinguished. And I think the lesson from the book is that the Jewish people have survived terrible pandemics that make COVID look like a birthday party, and will continue to do so.
Okay. And on that note, again, Dr. Brown, hopefully we won't be witness and have to suffer through any more plagues, God willing. Urge all our listeners and viewers to go online, as I did, the 11th Plague, Jews and Pandemics, from the Bible to COVID-19. It's just a wonderful, wonderful book. And I'm sure our listeners and viewers will enjoy it very much. Dr. Brown, thank you so much for today. We appreciate it very much. Thank you.
It's absolutely my pleasure. Thank you, Ari.